Hi everybody, this is Dr. Sridhar, Vennamaneni at Prathima Hospitals, Kukatpally. Today I just want to give you a brief update on common infection which we will be seeing in the next few months, dengue fever. Since the rainy season is starting in India, and with this hot weather we will be seeing a lot of mosquito-borne infections, and dengue fever is one of the most common infections that we see patients hospitalized for. We've been seeing this in the last few years, and in fact, recently we've had a few patients admitted for dengue fever. So this will be a brief update, and I'll take your questions subsequently. So dengue fever is basically an infection that's contracted by a bite from a mosquito that's infected with dengue virus. Now there are 4 different viruses, different strains of dengue virus. So even if you've had previous exposure to one type of virus, you're still at risk from 3 other different kinds. So you may have antibodies for one kind of virus, but the risk is still there if you're exposed to an infected mosquito. Now typically, once you're bitten by an infected mosquito, it may take up to 7 days to 10 days before you may start developing symptoms. And typically the symptoms of dengue fever is sudden onset of high fever, severe weakness, muscle aches, joint pains. Sometimes you can have a sore throat, dry cough, and you can have a lot of abdominal pain. You can have vomiting. In addition to this, in case of severe dengue, in addition to this, you can also have rash, fine rash on your arms, legs, abdomen. So these are the common symptoms. So it sounds like a typical viral fever. When you have a sudden onset of fever, severe weakness, you definitely need to be tested for dengue fever. So don't ignore that. And we all know the main problem with dengue fever is that your platelets can drop, your blood pressure can drop severely suddenly, and that can be severe and fatal. So high fever in any patient at this stage, you need to be tested for have a complete blood test, CVP, dengue fever, malaria, typhoid, all these need to be tested. Now, so in dengue fever, the other severe symptoms, in most cases of dengue fever, patients may have a mild case of fever, low-grade fever, and they might feel better within a few days. But once you have fever that's very high, and your symptoms are, if you have severe weakness, severe chills, abdominal pain, your stomach pain, vomiting, if you have all those symptoms, definitely I would go to the nearest hospital, get tested for dengue fever. Now, if you ignore these symptoms, we see this happen all the time. Patients have this high fever, they've had this for a few days, and they've gone to the pharmacy, they've not had any testing, they start taking some antibiotics, and they'll start taking some combiflam or aceclofenac, some kind of a non-steroidal medication to mask these symptoms. But all that will only make your situation worse. So because if your platelets are dropping and you start taking these antibiotics, or if you start taking these medications to lower the fever or for the pain, all this will will only make your situation worse, because your platelets will drop, your risk of bleeding will go up. Because in dengue fever, the severe case of dengue, you have what's called a hemorrhagic fever, where because of the sudden drop in platelets, you'll start bleeding. So that can be severe, and you can lose your life. So any high fever case, don't ignore it. Get tested. If it's a low-grade fever and if it subsides in 2-3 days, that's a different case. But most patients, high fevers, you need to be investigated. Now, for dengue fever, in terms of severe case of dengue, all of a sudden you can have severe, headache. You can have neurological symptoms. You can have seizures. You can have confusion. You can have severely significant dehydration with rapid heart rate. All these are signs of a severe case of dengue. And when we see those patients, a lot of times these patients are in the ICU for days. They may be on a ventilator. So we don't want patients to get to that stage. Now, how do we prevent dengue fever? The most common causes, since it's a mosquito-borne infection, especially in the evenings, we see mosquitoes are very active early mornings, like before sunrise, around that time, early morning, and then sunset after dusk. So dawn and dusk is when mosquitoes are really active. So if you are going out, make sure you wear long sleeves, wear some kind of a mosquito repellent. And at home, make sure you have screens and cover your windows and doors. Don't let mosquitoes come in. And even in your bedrooms, you can. It's good to have simple mosquito nets over your bed. One way to prevent it. And make sure you don't have any stagnant water around your house, because even a small bucket or any kind of utensil with stagnant water would be a source for the mosquitoes to breed. So no water around your house that's stagnant. Especially if you have plants around your house, you're more prone to have mosquitoes. So make sure you have somebody spray some kind of a mosquito bug killer. Now, the treatment part, since it is a viral infection, we don't have any specific antiviral medication for this. So typically what we do is, for dengue fever is, once we admit you, we start you on a lot of IV fluids to prevent dehydration. And we start you on some vitamins to help your bone marrow recoup the loss of platelets and blood counts. And then we keep a close watch on your liver enzymes, because dengue fever tends to cause inflammation in the liver. So we keep monitoring your liver, and we may have to give you some supplements for the liver. And then we need to also keep an eye on your lungs, because just like there's inflammation in all over the body in severe dengue cases, you get inflammation in the stomach, so there's a lot of swelling in the water fluid in the abdomen, and you get fluid around your lungs. We call it pleural effusion. So all these are things that can make your life miserable: short of breath, stomach pain, unable to eat anything, constant vomiting. All these are things that can make your life miserable. So we monitor all these things, and we give you medications to control all these symptoms. In terms of a vaccine, there is a vaccine that's not available in India, but in US and Europe, there's a vaccine for dengue fever. In terms of treatment, it's all how soon we can get you started on IV fluids, how soon we diagnose this. This is the most important thing. So I just want to restate the same thing again. If you have high fever with any fever for that matter, high fever, severe weakness, you could have something that could be easily treated with a antibacterial tablets, or it could be a viral infection. But this time of the year, in the next few months, we know that dengue fever is the #1 cause of hospitalization. So please don't ignore high fever, and especially with other symptoms, severe weakness, headaches, rashes, skin rashes, body pain, stomach pain, vomiting. All these are things that can be life-threatening. So I just want to let you know. Thank you. I'll take your questions from here. I didn't go in too detail about other things, because I just wanted to be precise, and I'll answer your questions. In terms of fluids, especially once you have a fever, it's very important that you start drinking a lot of fluids: ORS, electrol, coconut water, juices, whatever. You need to be constantly hydrating, at least 3 liters of fluids when you have fever. It doesn't have to be dengue fever. Any fever for that matter can make you weak and dehydrated. And this weakness can last for weeks, for 2-3 weeks, or even more. So the very first instant you have high fever, please make sure you start drinking ORS, electrol, some kind of fluids. I'll look at the questions from here. So the first question is about, the question states, we live in a gated community. There is 0 chance of mosquito bites due to the patient stays in a high-rise building. But my daughter got dengue fever and we were in shock. I would like to know what might be the exact reason and what precautions. So, irrespective of where you live, because there is stagnant water all over in Hyderabad, or different cities, we have stagnant water. You have lakes that are ponds that are full of mosquitoes. Nobody's spraying them. And you have, if you're driving around, you see a lot of open ditches. You see even water flowing through that's open and it's contaminated. And so mosquitoes are there everywhere. Even if we live in a nice community, it doesn't matter. Mosquitoes can come there. And usually you see mosquitoes in mostly around shrubs, plants. They are there. And if your kids are going out to play evening or morning after school or early morning, that's when the chance of getting bitten is high. And also, we do see mosquitoes even in when you're taking an elevator for that matter. There are mosquitoes, there could be potential mosquitoes there. Or if you go to a restaurant, there could be mosquitoes there. So it's not like you will be exposed in your community. It could even be in a school setting. You go to school, small children, there are mosquitoes in everywhere too. So it's like one of those things where unfortunately the chance of being bitten is high. So the only thing I would suggest is as much as possible, once the weather cools, if you can have them wear full sleeves, around the neck and around the arms, complete sleeves. And you can also, there's a spray that you can spray on the clothes to prevent mosquitoes. That's what I would do. And at home, like I said, in the evening, once you're close to 6 o'clock around that time, I would definitely make sure you close the doors. And if you have a screen, I would use the screen to prevent any mosquitoes to come in. And in their bedrooms, I would definitely suggest having a mosquito net, and that will definitely prevent unnecessary bites. So wearing clothes with long sleeves in the especially mornings and evenings, and closing your doors and using screens, using a mosquito net at night, and using a mosquito repellent on the clothes. All these are ways to prevent mosquito bites. Now, the next question is, can dengue fever be cured with Dolo? The answer is no. In fact, I wouldn't use, because it's a viral infection, and like I said, there's no specific treatment. And typically, once you're bitten by dengue fever and you have, once you get the infection, your platelets can drop up to 5 to 6 days. And you can have high fever for 5 to 6 days. And we see this all the time. Patients getting admitted for high fever and positive dengue, and the fever is not subsiding. And the patient is wondering what's going on and why is my fever not subsiding? Because if you have a severe case of dengue, you're really sick. You can be vomiting for days. You could be having stomach pain for days. You could be having cough, severe cough for days. You may not be eating for days. So all this is part of severe dengue. So, so Dolo will not touch dengue fever, because in a mild case of dengue, yes, it will work. But in patients who are requiring hospitalizations, you'll need better medicines than Dolo. So Dolo will not cure it. It will only cure the symptoms. It will reduce the fever. That's it. Nothing more than that. Now, the next question is, what are the chances of dengue fever becoming severe? The chances, see, most patients with dengue fever, they do well because most patients have mild cases. But if you have a high fever and the fever is high and you have severe weakness, you're not eating, severe fatigue, you're just lying in bed the whole day, then definitely you need to be tested, because that's when the symptoms can worsen if we don't give you fluids, we don't give you all these special vitamins and different medications to help it reduce the inflammation in the stomach and intestines, because dengue fever affects the whole body, not just the the abdomen or the lungs. In fact, the whole body is affected. There's inflammation all over. So for that reason, it's good if it's a mild case with low-grade fever, you're feeling better in 1 or 2 days, that's fine. But anything with high fever, severe weakness, I would definitely seek admission, seek some kind of medical help. The next question is, what are the immediate action we have to take when dengue attacked elderly? So with elderly patients, again, because elderly patients, their immune system is really poor, and their risk of dehydration is very high. So easily high fever can affect their kidneys, can make them drop the blood pressure, can affect their lungs. So, and they can be severely malnourished if they're not eating enough, because dengue really, in moderate to severe cases of dengue, you're not eating at all. So all these can make these elderly patients more sicker, and instead of a 1 or 2 day hospital visit, it may end up being even longer, 7 to 10 days or even longer. So for that reason, elderly patients, especially above 65, everybody, if they have high fever, should get tested. It doesn't have to be dengue fever that can make you sick. It could be a simple urine infection. It could be a pneumonia. It could be a stomach infection. So all these things in somebody who's elderly, especially if you're diabetic, if you have kidney problems to begin with, if you have lung problems, if you have COPD, lung disease, or severe asthma, all these are things that can make your life miserable, especially if you're elderly. So if you're somebody above 65, if you have underlying medical issues, high blood pressure, diabetes, kidney problems, your risk is even severe, much higher risk of getting hospitalized. So seek help immediately with high fever. That's my advice. Going to the next question. do we need to avoid connecting with people when we get attacked with dengue? The question is, if I have dengue, should I avoid contact with other people? The answer is it's not transmitted, by close contact. But let's say if you're in a house and you were bitten by a mosquito and the mosquito is in the house, and the same mosquito, if it bites another person in your family, they can develop these symptoms within a few days. So it's only mosquito transmitting the infection. So it's not a person to, like, if you were to meet another person without any mosquitoes around you, the risk of infection is zero. So only if the mosquitoes that have bitten you are in the house and they're biting some other person at night or during the day in the house, then there's a risk. So the chances of getting infected by simple contact is nil. It's only if you're sharing the same room or sharing the same house and the mosquitoes are still there, there is that risk. The next question is, what are the chances of getting other complications like malaria or typhoid along with dengue fever? So this is a very important question, because last year we've seen a lot of patients, for whatever reason, coming with dengue and typhoid. They're two different infections. Malaria, we haven't seen much malaria cases recently. So in fact, in the last 1 year, I haven't seen even one malaria case. So malaria is out, but we do see a lot of typhoid. So I'm not sure what is the reason for patients coming with both, but we test for both anyway. When somebody comes with high fever, we test for malaria, we test for typhoid, we test for dengue, because these are common infections. And we've had a lot of cases where patients had both the infections. So there's no relation, because typhoid is a bacteria, and you get that from infected water or food. If you're eating outside, somebody with the infection, if they're not washing their hands properly and their hands are contaminated, and if they're cooking a food or if they're serving that food, then you're going to contract. So it's a bacteria, whereas dengue is a virus. But we've seen a good number of cases last year where patients had both. Now, the next question is, recently my father got dengue fever and cured, but now he's repeatedly complaining about severe knee pains. What should we do, sir? So this is one of the things we see, because dengue does affect the joints, affects the muscles. So you will have severe pains, and it doesn't have to be knee pain, but especially if somebody has, I'm not sure what the dad's age is, but if your father's age is, but if he's somebody above 60, I'm sure he probably has some arthritis, osteoarthritis, which comes with the regular wear and tear, especially in the knees. And this arthritis will flare up. The inflammation in the body is still there, because we see sometimes patients with CRPs, which is a C-reactive protein. Some of these patients have CRPs above 300, 400, so which means there's severe inflammation in the body. So what should we do is the question. So the answer is, one is, for pain, if he's tolerant, you can give him some for pain medicine. Ultracet is a good pain medicine that can be used. I'm not sure what his kidney function is, because depending on the kidney function, then we have, and his other, like, does he have blood pressure, diabetes, we'll have to look at all those things. But there are medications for pain, for severe pain also. So I'm not sure what his underlying problem, medical issues are, but in most patients, Ultracet is pretty safe. It doesn't affect the kidneys and it doesn't affect the blood counts. But in addition to, obviously he may need x-rays and may need to be seen by orthopedic surgeon. There are other options for knee pain. Physiotherapy is an option, because sometimes patients have severe knee pain from weakness in the thigh muscles, quadriceps, so they may need physiotherapy. So ideally, patient needs to be examined for me to give you the right advice on that. The next question is, can you please suggest few prevention tips rather than mosquito mesh and repellents at home? We are seriously facing issues with these repellents and dupe sticks as well. Okay, so so the options are, at home, obviously, the best, like I said, most of the mosquitoes, they come into the house early morning, before 6:30, and evening after 6:30. So that's when, especially from that 6:30 to 7:30 in the evenings, and morning 6 to 6:30, just when it gets from dark in the morning, that's when they start coming in. So one, you have to definitely close your doors and windows, make sure nothing is open. And at home, obviously you have to have a mosquito bat and start looking for mosquitoes in each corner. And you have to avoid plants at home, because plants also are places where mosquitoes like to hide. So if you have any kind of pots with plants, they tend to stay in there. So if you have any of those, try to move them out of the house for at least for the next few months. Now let me see, what else did you say? Yeah, so the only other options is, at night use the mosquito net, because it does make a big difference. And mosquitoes also tend to hide behind curtains in dark areas. So under your bed they tend to hide. So in your bathrooms they tend to hide. Dark areas, that's where they tend to hide. So try to go to those places with a mosquito bat and get rid of all those, because I've seen this in my house too. So dark places, under the beds, these are places where bathrooms, that's where they tend to hide. So that's what I would suggest. Next question is, what are the best foods to take when a patient is suffering from dengue fever? So dengue fever, the main issue with dengue fever is dehydration and low platelets. So anything that will hydrate you. So eating a lot of fruits, as long as you're not vomiting, all the fruits are fine. Any kind of fruit, whether you're eating an apple, pear, banana, all those are fine. For the platelets specifically, we do recommend, papaya is good for the platelets. Even your pomegranate is good for the platelets. But in general, I would say fruits, vegetables, these are all good. And a lot of fluids, basically ORS, electrol, juice. You need to keep drinking, hydrating yourself continuously. That's very, very important. So, so my suggestion is more vegetables, fruits, and fluids. This is the answer. Okay, I would stay away from meats when you're sick, because all that fat will only make your stomach more, nauseated, and you'll be having issues with indigestion. The next question is, please tell me the best foods for children to get protected from these viral fevers. I mean, see, there's no food that will prevent these infections, but in general for the children also, because we're seeing a lot of, with all this globalization and people having more money, we are seeing children eat more junk, more fried food, more chips, more snacks. So I would slowly try to wean them away from those and try to, introduce more more fruits. Basically, fruits. Any kind of fruit, 2-3 fruits a day is a great thing, and preventing, in general, for any kind of to prevent long-term cancers, heart disease. All these require eating more fruits and vegetables, cutting down on the meats. Some nuts, these are all good for immune system also. Making sure that they sleep well, 7 to 8 hours of sleep is important. A little bit of exercise, 30 to 45 minutes, all this is also good for immunity. So in terms of best foods, I would say fruits and vegetables, small amount of meats, and some nuts. That's the best foods. Now, the next question is, my mother is a diabetic, and recently she had a fever, doing better now. So what is the exact cause of the fever was not known. Please tell me if you need to take any tests. So yeah, so here's a patient who has a diabetic, had fever, but recovered. So the best way is, you can do what's called a fever profile. It's a simple blood test. In the fever profile, we check your complete blood picture. We get a ESR, CRP, we get your malaria test, we get your typhoid test, we get your dengue test, and a urine test. So pretty much the common infections will all show up on that test. So it's called a fever profile, and that's what I would recommend. Now, the next question is, how does dengue affect the other organs of the body? So commonly, the main organs that it can affect are, number one is the lungs, where it can start from the head all the way down. In the brain, you can develop seizures, you can develop inflammation called encephalitis, you can develop confusion. That's on the brain. Coming down to the lungs, you can develop severe fluid around the lungs. It's called pleural effusion. So that will make you short of breath, make you cough. And also severe dengue, you go into respiratory arrest. Your lungs will collapse. So there's that risk. And coming down into the abdomen, you get inflammation around the liver. So your liver gets swollen. Your liver tests go out of range. And then you get a lot of fluid in the around the stomach, inside the stomach wall, and in the abdomen around the different organs. So you tend to get a lot of abdominal discomfort, fullness. And then in general, as you go down, you get severe inflammation in the muscles, joints, so you have a lot of pain because of that. Now, the next question is, what are the chances to get dengue fever again after recovery? So the chances are not, like I said, there are 4 different kinds of dengue fever. So what you need to be aware of is that if you were exposed once, there's still a chance of getting 3 more different kinds. So we don't know what kind is prevailing because we don't go into that many specific testing. But unless you had 4 different kinds of 4 times dengue fever, if you've had 4 different times, then your risk is very negligible, because if you've had antibodies from all these 4 different kinds of infections, what is your chance of getting another infection? Is very low. But if you've had only once or twice dengue fever, there's still that risk. So that's what I would like to educate you. 4 different kinds. So even if you recover once from one infection, the next time there's a chance that you might get a different infection. Okay. Now the last question is, can we have brief preventive tips for dengue fever? So prevention is basically trying to, if as much as possible, trying to avoid going out in the evenings and mornings. I mean, if you were to go out mornings or evenings, make sure there's enough light around your house, because most of these mosquitoes are active when it's dark. So if you have good lighting around your house, mosquitoes will be hiding somewhere, they won't be coming out. Number 2, wear long sleeves as much as possible with some kind of a repellent on your clothes, because usually if you wear that repellent, you can even have some trees like eucalyptus plants, or you can have the lemongrass, or mosquitoes don't like anything flowers with scents like your marigolds, so or your mint and lemon plants. All these are things that repel mosquitoes. So if you have those, that's a good way to prevent them. But in general, covering yourself, using a mosquito repellent, and at home covering your house with meshes, and trying to use mosquito nets at night, that's the best way. And if you have any kind of fever, I want to reinstate this very, very important thing again. If you have high fever, don't ignore it, please get tested. If it's a low-grade fever and you can cope with it, it's not severe weakness, then you can try a low dose of paracetamol, a lot of ORS liquid, and see how it goes. So that's the end of the questions. So at the end, I just want to thank you for listening to what I've said before. But any high fever, especially in somebody who's older, or somebody who's pregnant, or somebody who's very young, please don't ignore it, because that can be life-threatening. Dengue fever is a simple infection. It can be easily treated. So please get tested, and please be careful with like all the precautionary measures that I've told you. Thank you.